Late in the evening or on a weekend, your child is sick or hurt. Do you have to hurry to the ER, or could urgent care cover it? Dr. Tom Tryon from Children's Mercy is here to help us answer that question. Welcome to the show.
Thank you. Thank you for having me.
Okay, so what are the differences between the emergency room versus urgent care?
I look at urgent care as being kind of between a physician office and between that and an emergency room. So an emergency room can handle just about everything that walks in the door, whereas in an urgent care, we typically handle acute problems that came on suddenly, but that aren't life-threatening emergencies. And some of the things that we handle also are kind of outside of what most primary care physician offices would handle.
Do you think you get in quicker when you go to an urgent care facility?
Typically you do. In urgent care, we try to keep the urgent in urgent care, and so the idea is to get you in quicker. And because we're not having ambulances coming into urgent care, and we're not having major traumas coming in and things that are taking a lot of time, typically we can see patients more quickly, and we can get you in and out the door more quickly.
What are common conditions seen at urgent care facilities?
Well, about a third of what we see are injuries, and usually they're minor injuries. They're things like ankle sprains or knee injuries or elbow injuries or shoulder injuries or things like that. We also see simple fractures. So if you have a child that falls and hurts their arm or hurts their leg, and you're concerned that there might be a fracture, we see that in urgent care as well. We also see all the kind of routine illness things, so ear infections, throat infections, strep throat, pneumonias, coughs, asthma flare-ups, croup, all of those types of things are pretty common things that we'll see in urgent care.
I think as parents, we always get so nervous when our kids are sick. We want to do everything right. And it can be scary, especially on the weekend when you can't call your normal doctor. If you have a question, is there someone you can call, or should you just go ahead into urgent care if it's not life-threatening?
Well, one of the things you can do is call the urgent care and say, is this something that you typically handle in your urgent care? And sometimes that will save you a trip to the urgent care. Once you check into urgent care, they have to see you, and then they may have to refer you on to an emergency room. With our Children's Mercy urgent cares, parents are really pretty astute, I think, because only about 3% of our patients have to be transferred to an ER or have to be admitted to the hospital. So the majority of patients that come in, the parents have picked the right place to be seen.
So when should a parent say, we need to go to the ER right now?
I think a good rule of thumb is if you're considering calling an ambulance, you should go to the ER. So, and that includes car accidents. We see a number of patients that come in where they refuse an ambulance at the scene, and then they brought their child into urgent care. Urgent cares typically are not really geared to handle trauma. So if you're concerned after a car accident, it would really be ideal to be seen in an emergency room setting. The other thing is, if you're concerned that your child may have a surgical condition, so we don't have surgeons in urgent care, we have limited radiology capabilities, so it's not a great site to work up things like appendicitis or other surgical conditions. So if you're concerned about it being a surgical condition, an emergency room would be the best place to go.
Well, thank you so much for your advice. Some great advice there. Well, for more information about urgent care versus ER care, including locations for Children's Mercy's 3 urgent care centers, check out our website later on today. It's kclive.tv. Thanks so much for joining us.
Thank you, Michelle.